Annie Garcia, The Mystery Death by Noah Carroll and Zach Mintz, breaking down the mystery. We are students trying to find a viable solution. Our information of diabetes involving Annie Garcia is presented here. Type 1 diabetes. Someone with type 1 diabetes cannot produce insulin because the white blood cells attack and destroy the beta cells. Due to this, type 1 diabetics have to inject insulin, calculate glucose in food, test their blood glucose levels, and monitor levels constantly every day. Hyperglycemia is when your blood glucose levels are too high. This can be caused by lack of insulin, sickness, incorrect calculations, and many other things. Short-term effects of hyperglycemia. 1. Ketoacidosis. This occurs when the body breaks down fat too fast, making too many ketones which make the blood too acidic. 2. Blurry vision. This happens when blood glucose levels in the eye are lower than what it is in the blood. Osmosis is then performed by the body, meaning that water flows from the eye into the blood vessels. The effect of this is warping the lens of the eye. 3. Frequent urination. Glucose spills into the urine, water following, because the kidneys cannot absorb all the glucose. Long-term effects of diabetes. 1. Retinopathy. This occurs when high blood glucose levels damage the blood vessels in the eye. It eventually causes these vessels to pop and can lead to blindness. 2. Nephropathy. The kidneys contain millions of tiny blood vessel clusters that filter water from your blood. This happens as the glucose sticks to these vessels and provides a home for new infection to breed and live. The excess glucose can be a risk for UTIs. 3. Atherosclerosis. High blood glucose levels can damage artery walls over time, allowing for plaque to build up to begin. This plaque eventually leads to none or little blood flow or even the breaking of the artery. Both of these can cause heart attacks and strokes. 4. Neuropathy. Excess glucose can damage the walls of the blood vessels that nourish the nerves. With no nourishment, the nerves do not function properly, causing no feeling, which can lead to ulcers. Specifically, this can occur in the feet or legs. If bacteria gets into the ulcers and causes an infection, the leg or foot may be amputated.